There are times when the cancer outcome is not positive, when cure is no longer possible. This is where palliation comes in. Palliative care offers a positive approach to caring and encourages people to live as full a life as possible when faced with a life-limiting illness.
Palliative care is care that focuses on the quality of life for a patient, and that might involve looking at symptoms that are bothering the patient or other things like emotional concerns, spiritual concerns, a very broad range of things that a patient might be having difficulty with. One of the things that we need to emphasise, though, is that palliative care is really very active care and not just relevant right at the end of life. It can have a place right through the course of an illness.
The approach of palliative care is really a very holistic approach. So it looks at the whole person, the whole experience of the illness in their life and how it affects them, not just as a disease, but as an influence on everything that occurs in their life. It also impacts on the family and the social situation, the social network of the person with the cancer. And palliative care tries to offer a support system for the wider support group of the patient as well as the patient themselves. So not only do we think about the needs and problems that the cancer is causing the person with the disease, we think about how that affects the people around the patient.
Palliative care has really changed over the last 20 years. People used to think that if you were referred to a palliative care service or sent to a hospice, that was simply the end of your life. But what we've come to realise is that many patients benefit from good symptom control early in the course of an illness, and then they may not need to have any further input from a palliative care service. So we're very keen to get away from that image of being just right at the end of life for patients, so that they do access and get better symptom control right through what can be prolonged illnesses now with the cancer diagnosis. Complementary therapies can be very helpful. Obviously that term covers a whole range of therapies, but things like massage, relaxation, music therapy, art therapy can all help patients deal with symptoms such as pain and anxiety, that sort of thing. The mind itself is very powerful, and patients who are dealing with real physical pain can still learn techniques of meditation and things like that to actually help them coping with the pain and to some extent even reduce pain. I think the strongest message is to start treating it early. That pain that's been unrelieved for a long period of time is harder to get on top of. We use a combination of medications, starting with just the very simplest things like Panadol in its various forms and maybe anti-inflammatory medications. And then if they're not sufficient, then we would move into the group of drugs known as opioids. And there are quite a range of those now that can be tailored to the patient's needs.
Whilst I had a lot of help from the various places and people, doctors, etc., the final decision was always mine, and during the hours of night I was there on my own and not having any nursing background or anything. That was very difficult because one son was interstate and the other one, because they'd left home a long time ago. It all actually came down to me, and I was dealing with something that I really didn't understand.
Caring for someone at home can be very demanding but also very rewarding. And my first piece of advice is to accept help. Sometimes people feel they need to do it all on their own and as a result become really worn out in caring for someone at home. So there are services that will help with nursing, respite, that sort of thing. So please accept help. There are now quite a few useful publications that can give you advice about how to care, the sorts of things that might come up, and the Palliative Care Council would have access to those as well. So certainly, if it's something that you want to do and that your loved one wants to stay at home, then everyone will help as much as possible to make that happen for you. There are certainly a lot of emotional issues that come up when you're caring for someone who is facing a terminal illness at whatever stage of that illness. And help can be provided. The palliative care services will have counsellors and social workers. Your own local community may well be able to help you access those. Or there is the Cancer Council helpline, which can provide some advice in a crisis situation. But I think the key is to plan ahead, to talk about things early, not bottle things up, not try and do everything on your own, to let people help and to reach out for that help.
In terms of the costs of palliative care, they're generally no different to any other aspect of care the patient receives in our health system. Most specialist palliative care services provide their services free to patients and families, and the community services that they work alongside are greatly subsidised by state and federal governments, and so that their services are often free or very affordable.
There's no shortcut to beating cancer, but the survival rate is improving all the time. If you look at the survival statistics, remember they are the averages. The average survival rate for the average person. Make sure you're anything but average. Tip the balance in your favour by learning all you can about your disease. Question your doctor until you get the answers you want. Improve your diet and make sure you exercise. And don't be afraid to ask for help. But in the final analysis, it all comes down to you. Your mind is the most powerful cancer-fighting agent of all, so believe the treatment you're undergoing is the right treatment for you, and you're halfway there. You will have negative thoughts, it's only natural, but having a positive outlook does work wonders. Don't say, why me? Say, okay, I have cancer, what now? What do I have to do to beat it? Remember, you're not alone, and there are cancer survivors out there only too happy to share their experiences and advice. Good luck on your journey.